The other major area that we'd like to address today is that of compatibility.
I'm Dr. Paul Karpecki. I'm going to talk about the area of lens solution compatibility. We're going to look at this from a number of perspectives, including the area of in vivo, as well as ISO standards, as well as in vitro compatibility, and specifically in the area of Renew Multi-Plus compatibility with silicone hydrogel lenses. First thing we're going to examine is compatibility based on the ISO standards in 4 different variables related to the most common silicone hydrogel lenses. That includes the Bausch & Lomb Pure Vision lens, the AccuView Advance, the AccuView Oasis, the O2 Optics, and the Focus Night and Day. And in the 4 areas we're going to look at, the first one is diameter changes. When a solution soaking a lens takes place, they can then look at compatibility based on a number of these standards, the first one being diameter. And as you look at the standards there, you can see that all the lenses involved with Renew Multi-Plus are well within the ISO standards. That's also going to be done by looking at the changes in power. And once again, all those variables show compatibility within ISO standards. The third area of compatibility is the area of base curve. And once again, the ISO standards are all within range. And then finally, any change in thickness was also fell within the ISO standard specifications. Now I'd like to look at the area of compatibility with human corneal epithelial tissue. And perhaps one of the best ways to look at this is to measure sodium fluorescein permeability. The basis for this is that if a membrane is allowing sodium fluorescein intake, it's likely to be greater toxicity. And this control is compared to balanced saline. As you're well aware, balanced saline would be something that mimics normal corneal tissue. So it's going to be perhaps the most even in terms of toxicity. And as we can see here, that is exactly what we're seeing. It really has the lowest level. But interestingly enough, when you compare it to Multi-Plus, you can see that actually that's very close. The Renew Multi-Plus is very similar to what you're seeing with balanced saline solution. And Complete, also very similar as you compare it across the 3. And then we finally see a trend moving forward with the Opti-Free solution, which would indicate a move towards increased toxicity. Another area of compatibility with human corneal tissue is to look at Alamar blue uptake. And this is basically a measure of the vitality of the epithelial cells. If there's a lot of uptake, that means the cells are very active and very alive. And so what you want to see in this instance is levels close to the balanced saline solution as a comparison once again. And first looking at the Renew Multi-Plus solution, we see that that's very similar to the balanced saline in terms of Alamar blue uptake, meaning that the cells remain quite vital. We see that also with Complete. Then we start to see a change only at the level of Opti-Free. And at that point we see a considerable decrease in Alamar blue uptake. This next area, compatibility, looks at 3 different variables. The first one is direct contact, and that is what's the assessed cytotoxicity from the direct contact of solution on the epithelial cells. Then we'll look at trypan blue uptake. Trypan blue is basically a measurement of the amount of dye within the cells, which increases as the membrane is essentially damaged. So the more tryptan blue that's involved, the more likely that there is damage to the membrane, leading to more uptake within the cells. And finally, we're going to look at cell regrowth. If we evaluate the cell's ability to regrow after having been exposed to the various solutions. And in this case, a number of solutions are being utilized in comparison. And as we look at the table, pretty much at all levels we see no toxicity, except as we get towards the bottom 2 right levels, where we see tryptan blue uptake with the Opti-Free solution being elevated and cell regrowth also showing cytotoxic effects. Now what people really want to know is the comparison between in vitro studies, as I just examined, versus in vivo, or live epithelial cell studies. And we can tell here a real nice comparison between the table that I just showed you on the left, and then on the right, the area of effects on rabbit epithelial cells. And on the right, what you're seeing here are micron electrographs that show the level of changes. And what's interesting is that it does tend to mimic very similarly to what we just saw in vitro. A normal control epithelial cell, as in this case the rabbit epithelial cell, tends to have a unique tight junctions that you can see there. It also has these tiny little holes that people often refer to and look at. Those are exfoliation holes. those are very normal. They're meant to be there. They actually allow for the normal cell regrowth period of a life of a typical healthy cell. And so as they're there, then they largen and the next cells come in. So you want to see those. And you also want to see that same sort of texture. You'll notice that when cells were soaked, the contact lens in this study was soaked for 12 hours in either Renew Multiplus solution or the Alcon Opti-Free solution. Then it was placed on the rabbit cornea for 2 hours. After 2 hours, they then went and took these electron microscopy images of the rabbit epithelial cells. You'll notice that with the Renew Multiplus, it's very similar. You see very tight junctions. You also see a very close level in terms of the exfoliation holes. And you see that it's very similar to the control. Now then you look down to the Opti-Free, and interestingly enough there you see a number of things. One, the exfoliation holes have certainly either gotten considerably larger or missing. Even the texture shows that there may be changes in there, and most importantly, the cell membrane junctions appear to be damaged or not quite as solid as in the control. So here we have an in vivo study on rabbit epithelial cells, which very closely mimics the in vitro study which we just examined earlier. Finally, doctors want to know what this means to their patients. We all appreciate the in vitro studies and certainly the in vivo studies related to rabbit epithelium, but basically to look at the effects on human epithelium, we have to look at clinical ocular response studies. And in one study looking at silicone hydrogel compatibility, comparing the Renew Multiplus to Opti-Free Express, this study looked at a number of variables. Unlike certain studies that may look at one particular variable and focus on that, I think it's really important to have studies that look at all possible adverse events and complications, including things like epithelial edema, epithelial microcysts and other relationships to hypoxia, corneal staining. We also look at limbal injection, bulbar injection, neovascularization, and the formation of infiltrates. 237 silicone hydrogel lens-wearing subjects enrolled in the study. 119 were Renew Multiplus, and 118 were Opti-Free Express. Silicone hydrogel included in evaluation were Pure Vision, the Night and Day, the O2 Optics, the AccuView Advance, and the AccuView Oasis. Scheduled visits were 2 weeks, 1 month, 2 months, including scheduled and unscheduled visits. There were 692 eye visits for Renew Multiplus and 712 eye visits for Opti-Free Express. Now as we look at these individual areas within the tables, for all graded slit lamp findings, grade 2 or greater, Renew Multiplus demonstrated that it was not inferior to Opti-Free Express at all follow-up visits. And many times, doctors say, or studies suggest to imagine that there's a link between corneal staining and other adverse complications. And anytime you hear the word imagine, that probably means that there's not a lot of clinical science behind it. And in one area you want to look at is that area specific to infiltrates. And there were no Renew Multiplus eyes with corneal infiltrates in this entire multi-center study. There were no eyes with adverse events reported in the entire study as a whole. And then lately what's been getting a lot of mention is the whole area of corneal staining. And with this area we've highlighted in the bar, I do want to pass this over to Dr. Snyder, who'll discuss this area in greater specifics.
Well, Dr. Karpecki, that's very interesting information about corneal staining. Let me go ahead and take that data from that table and pull it out and go ahead and graph it here, because it's easier for me to appreciate it when we do that. This actually shows a low incidence of corneal staining related to solution intolerance. The important thing here is that I've taken the grade 0 and grade 1 staining and stacked them together, because grade 0, of course, is not important, and grade 1 is trace, mild, minimal, not clinically significant on 4-point grading scales. So if we look at the two of those together, grade 0 and 1, with Renew Multiplus, it was a 96% of the patients were either grade 0 or 1. 99% of the patients with Opti-Free Express were grade 0 or grade 1. There was not much at all in the higher grades. Now, I do want to caution you here that the height of the towers are very similar, but there are differences, and it's possible that if you did a statistical analysis between the two products, you might be able to show that there's a statistically significant difference between the 96 and the 99. What I'd like to do is encourage us to keep it in a proper perspective and realize that what we're talking about here in the big picture is grade 0 and grade 1 staining. any differences, particularly small differences by inspection here, that we might be able to support with statistical differences, are not going to be relevant to us clinically. These are just not significant differences in practice. Another way to look at this is to say that out of 100 patients that used Renew MultiPlus, 96 of them would have had either grade 0 or grade 1. In contrast, Optifree Express, 99 out of 100 patients would have had grade 0 or grade 1. We're talking about just a difference of about 3 patients between those two lens care products out of 100 patients.